The greatest cause of death amongst Indigenous Australians is ischemic heart disease, more commonly known as coronary heart disease. It's a condition in which plaques and fats build up in blood vessels and eventually occlude vital blood supply from getting to the heart. Without a blood supply to the heart, people are at huge risk of dying or having significant injury. Although coronary heart disease is also a leading cause of death amongst non-Indigenous Australians, it impacts Indigenous Australians from a much younger age. In 2016, Indigenous Australians aged between 35 and 44 were almost 5 times more likely to die of coronary heart disease than non-Indigenous Australians of the same age. Indigenous Australians are twice as likely to be diagnosed with coronary heart disease as non-Indigenous Australians and twice as likely to be hospitalised due to the condition. The Australian government is endeavouring to reduce the life expectancy gap between Indigenous and non-Indigenous Australians, but the target is falling short and it's not on track. Indigenous Australian men have a life expectancy of around 8.6 years lower than non-Indigenous men, and Indigenous Australian women have a life expectancy of around 7.8 years lower than non-Indigenous women. Coronary heart disease and its causes need to be addressed in order for Indigenous Australians to live longer and healthier lives. To do this, it needs to be considered how Indigenous Australian culture and a colonial history have influenced health, what the risks are that are contributing to this problem, and what the barriers and enablers for Indigenous Australians are for accessing healthcare. Many Indigenous Australians have a complex perception and definition of health, which encompasses a balance of physical, mental, social, cultural, and spiritual well-being. There's also an emphasis that health and well-being of individuals depends on the community and vice versa. The culture of Indigenous Australia is rich in beliefs that the land a person belongs to is sacred and spiritual. It's often referred to as country. Many Indigenous Australian cultures relate to their ancestors and pass down stories about creation and life. This is known as the dream time. Despite Indigenous Australians' rich beliefs and traditions, their way of life was significantly changed in the 18th century with the arrival of European settlement. Colonisation caused Indigenous Australians to incur a loss of land, exposure to foreign diseases such as smallpox. They also saw a destruction of food and water resources and experienced violent conflict. The separations of families, removal from country, and decimation of language groups has impacted on cultural knowledge. The stolen generation refers to a group of Indigenous children forcibly removed from their families and country as a part of a government assimilation policy between 1910 and 1970. This policy of assimilation forced Indigenous Australians to integrate into white Australian society and forego their identity, culture, and language. This has had a severe impact on health and well-being, as connection to country and kinship are essential elements of social and emotional well-being for Indigenous Australians. The intergenerational trauma caused by colonisation has contributed to significant negative impacts on health and well-being being passed down through the generations. It can disempower people and interfere with self-determination, which is one of the most significant social determinants of health for Indigenous Australians. Racism and discrimination can have a seriously negative impact on health and well-being. Indigenous Australians weren't even recognised as Australian citizens until the 1960s. Australia's federal and state governments have a long history of creating policies and legislations which have promoted the mistreatment and social exclusion of Indigenous Australians. This racism and discrimination has seen many people excluded from healthcare, housing, employment, education services. This increases vulnerability to health problems and poor literacy health outcomes. There are several non-modifiable and modifiable risk factors that make many Indigenous Australians more vulnerable to coronary heart disease. The non-modifiable risks, so things that people can't change, are age, because as people become older, they become more at risk of coronary heart disease. This is a real issue for Indigenous Australians as people are being affected by this disease at a younger age. Also, genetics, so people who with a family history may be more predisposed to the condition. The common modifiable risk factors of coronary heart disease include smoking, being overweight, having a sedentary lifestyle, excessive alcohol consumption, and stress, as well as having other modifiable health conditions such as type 2 diabetes, high cholesterol, and hypertension. A nationwide survey amongst Indigenous Australians found that a concerning amount of people could be categorised as having these modifiable risk factors. Around 42% of Indigenous Australians smoke tobacco. Around 66% of Indigenous Australian adults had a BMI above healthy standards. Approximately 1 in 5 Indigenous adults are considered hypertensive. Also, Indigenous Australians are 3 times more likely than non-Indigenous Australians to have type 2 diabetes or elevated blood glucose levels. And also 60% of Indigenous Australian adults living in urban areas reported to being physically inactive or having a sedentary lifestyle. Stress is also a really significant modifiable risk factor for coronary heart disease. A health and wellbeing report in 2017 found that 2/3 of Indigenous Australians experienced stresses related to issues like death, unemployment, and physical and mental illness in the previous 12 months. There are several barriers for Indigenous Australians which reduce access to quality healthcare, but similarly several enabling factors that promote access to healthcare. A major barrier preventing access to healthcare services is poor communication between healthcare systems and Indigenous Australians. Language barriers do exist for some Indigenous Australians. In 2016, 10% of Indigenous Australians reported that they spoke an Indigenous language. This reflects the need to consider providing healthcare and health promotion in language and organising interpreters. Poor communication contributes to poor health literacy outcomes. Furthermore, cultural barriers can create misunderstandings. Some Indigenous cultures have a fluid concept of time, as well as beliefs about shame and specific roles and expectations around gender and age. If healthcare providers do not consider these needs, people may feel uncomfortable to access healthcare services. Socioeconomic disadvantage caused by lower rates of employment, education, and adequate housing can also create major barriers to healthcare access. A lack of affordable local services or knowledge of their availability can deter people experiencing financial difficulty from participating in the services. A major enabler of accessing healthcare are Aboriginal community-controlled health services, which are services provided for Indigenous Australians by Indigenous Australians. The services are tailored to local communities and provide culturally safe and inclusive services. They aim to holistically consider a person's health, including their background and physical, mental, social, spiritual, and cultural wellbeing. Aboriginal community-controlled health services are an essential part of individuals and communities attaining self-efficacy and self-determination. For any service provider, meeting cultural preferences of Indigenous Australian people can enhance stronger relationships and rapport between practitioners and Indigenous Australian patients, which may increase the uptake of healthcare services. Disparities between Indigenous and non-Indigenous Australians' rates of access to quality healthcare exist due to a complex history and socioeconomic disadvantage. This existing disparity between Indigenous and non-Indigenous Australians can be diminished by ensuring that policymakers, healthcare service providers, and the general community consider the needs and wants of Indigenous Australians and ensure equitable distribution of resources. In order to reduce the rates of coronary heart disease amongst Indigenous Australians, it's essential that barriers to accessing healthcare services are diminished. Supporting self-determination through Aboriginal community-controlled services is a vital way of making an impact on modifiable risk factors, which will in turn increase positive health outcomes.